Good afternoon, citizens of Shelby County. I'm Dr. Bruce Randolph, the Health Officer for Shelby County Health Department. I'm here today to give you an update on our daily COVID-19 data. As of August the 4th, 2020, we have a total cases of 22,120. We have a total of 207 new cases as of today. We also, unfortunately, have had 286 deaths, which represents 2 additional deaths compared to yesterday. We're beginning to see some positive indicators. Primarily, numbers of cases over past few days have decreased and is showing a downward trend. One while we had as many as 400 a day, then in the 300s. Now it's down into the 200s. We also have noticed a gradual improvement in our positivity rate. At one point, in some days, it has been up greater than 16%. Now it's showing a downward trend, currently at 15.8%. We're expecting that this will continue. We contribute the decline that we're seeing to the use of the face coverings and mask use, as well as the restriction of the limited service restaurants, bars, and clubs. We're continuing to monitor the hospitalizations rate. We still see some increase in the number of people being hospitalized for COVID-19 and also increase in the intensive care admissions. However, currently our hospital systems are able to care for all those who are being admitted. The other thing that I want to just comment on, as well as you have heard in the news, that the mayors of Tipton and Fayette counties both have enacted mask mandates this week. The mask requirement goes into effect for Tipton County today and tomorrow in Fayette County. Regarding school, sports, and activities, as you well may be aware, last week Governor Bill Lee issued Executive Order 55. This allows local education agencies and schools, districts to permit school-sponsored sporting events and activities. This provides for all such activities, including practices, games, and competition. They can do this and can conduct these activities if they do so in a manner that is consistent with the COVID-19 regulations adopted by the Tennessee Secondary School Activity Association. Schools are not required to permit sport activities. This is a decision that each school will have to make. The health department is available to provide some guidance and technical assistance, but we're not approving or disapproving any type of plans. This is something that each individual school will decide. Lastly, you may be aware that last week the University of Memphis announced its plans to begin the fall semester with online and virtual classes only. We have today as our guest the University of Memphis President, Dr. David Rudd, who will come and discuss the university's plan. And at this moment, I want to welcome Dr. Rudd to the podium.
Okay, thank you. I appreciate the chance to talk with you. We announced last week that we would be returning to campus in a phased manner. In the first 30 days would be predominantly remote or virtual in nature. That was in response to a number of variables, including the significant number of increased cases and positivity rates that were just summarized for you. Along with the complicating factor for us, which is an issue for many universities around the state and around the country, is access to large volumes of testing materials and rapid turnaround time on testing results. Those certainly were significant issues. Now, we will have, and we have had, some continued very small class activity on our campus, but it is well within the guidelines that the health department locally, across the state and nationally have recommended. We've continued that from the onset of COVID-19 about 6 months ago throughout the entirety of this health crisis. In addition to that, we have had students in housing throughout the entirety of this, given that we have a large number of students that don't have access to other housing. We have managed that very effectively. We have had no significant difficulty or outbreaks, and we will continue to manage that moving forward. We expect to have students in housing throughout. All of that is carefully managed with symptom monitoring, testing, and tracking for our students throughout the process. We will continue to update on a regular weekly basis, so we have a team that monitors current data. It's good to see that there are some positive trends. If those positive trends continue, we need at least 2 to 3 weeks of good trend data to alter any plans on campus. Ideally, if we have good trend data, we will return some small classes and instruction to campus, most likely in a hybrid model that allows students that were already attending virtually to continue that if they have significant risk or other concerns. We will keep our students, the university community, as well as the broader Memphis community updated on a regular basis, consistent with the data that we're sharing. And we're very much appreciative of the collaboration and the opportunity to share what we're doing at the University of Memphis. At the forefront for us is certainly the health and safety of our staff, our faculty, and our students. Our university and this community is about people, and we want to protect the health and safety of all those that are involved with our university. With that, I'll stop, and certainly happy to respond to any questions.
Omar Yusuf, Daily Memphian.
Hello, can you all hear me?
Yes.
So my first question is for Dr. Randolph. I was wondering if we could get an update on the tripwires document. I know last week Dr. Haushalter said that it would be ready by Friday afternoon. So when can we expect to see that document?
The document is still being prepared, and it is not ready yet for release. The exact date I cannot give to you, hopefully by the end of the week, but I can't promise that.
Your follow-up?
Yes. So also another from a couple of weeks ago, there when you all announced that testing capacity.
I think we lost Omer, so we'll move on and hopefully come back. Sam Hardiman, Commercial Appeal.
President Rudd, you said that you're going to give an update after 30 days and you're going to be monitoring conditions on the ground. What does positive trends look like? What specific health metrics have to be improving for that hybrid approach you talked about to be instituted? And then I'll have a follow-up.
Yeah, we'll actually give updates before the 30 days. We'll likely do that if we've got 2 good weeks of positive trend data. We're still working on what we believe thresholds might be in terms of overall positive number of cases, positivity test rate, as well as the turnaround time on available testing for us. But we would want at least 2 weeks of good trend data down. And again, we're discussing what we think maybe the threshold values might be, and when we've got a better idea of what we think would be the thresholds that would allow a more dense return. And I'll remind you, our campus is currently functioning at about 35% to 40% density currently.
And then my follow-up is for Dr. Randolph. What data does the task force have on Memphis area hospitalizations in terms of where people are from, and I apologize if you hear a cat in the background.
Well, as you know, that most of our healthcare system is somewhat regional in that patients who may get admitted into the hospital would come not just from Shelby County and the municipalities, but the surrounding counties and even states. And so each hospital system would be able to provide exactly the information as it relates to the residency of their patients. We ourselves do not follow that information closely, primarily because our focus is Shelby County.
Alex Coleman, WREG. Alex Coleman, WREG. Okay. Kendall Downing, WMC.
Hey everyone. First question is for Dr. Randolph. I was wondering if you can tell me if the health department is keeping data on school systems and cases within school systems, and will that data be available for public release as to the number of cases in school systems? Because I know the state is not collecting, the state health department is not collecting that data. And then also, could you talk about football games and other sorts of sports activities? I know that there are some specifics in the TSSAA guidelines, but how will the health department work to ensure that all of these football games that could be going on across the area, social distancing and masking is being adhered to at those events? Thank you.
Okay, to answer your first question, yes, we will track the information as it relates to cases and contacts, just as we do for any setting, any situation where we're notified that there are positive cases and contacts. Now, whether we would release that information to the public, it was something that we hadn't quite yet decided. And as it relates to your second question, it is our belief that the governor's executive order pretty much preempts us from actually having a say-so in terms of the game, the competition, the practices. However, we do believe that we still have a responsibility and authority over the facilities and the venues in which these sporting activities occur. And so we still will expect that the facilities will adhere to the safety measures outlined in the health directives. Of course, now, if there are any players or students who happen to test positive, we will know that and certainly be involved in the isolation and quarantine process.
Brad Broders, Local 24.
Good afternoon. First question is for Dr. Randolph. You may be aware that Corinth High School opened last Monday. They already have 5 positive cases reported according to the district. My question is, should parents who are returning to local in-person learning be just have to accept the fact that it's likely there will be cases, potentially widespread? There will have to be quarantines, isolation plans. What would be your message to parents as some of districts locally return to in-person learning? And I have a follow-up.
My message to parents and to the citizens and to everyone, the coronavirus is here. It's not going anywhere soon. And there is a risk of being exposed and infected with it. The safety measures that we provide to individuals, to services, businesses, and to schools are our best effort to try to decrease the risk of contracting the virus or being exposed to the virus. But there is a risk. I cannot stand here and tell you that it is absolutely 100% safe and without any risk sending a child to school or teacher. There's a risk. What we're trying to do is to limit that risk as much as possible.
And thanks, Dr. Randolph. And as a follow-up segueing out of that, obviously with an inherent risk there, what do you think for parents out there as they're returning their children to local districts, some with 5 days of in-person learning, what's important for parents in your mind to be aware of? And what's important for specifically, what should parents be looking for that is in the classrooms and the hallways, and what should those districts be doing as well?
Well, I think that the safety measures that we outlined in our health directive, primarily the wearing of a mask, a facial covering, the separation of at least 6 feet, the hand washing, using hand sanitizer, the cleaning, the avoidance of crowding and gathering. These measures apply even within the school. So one of the fundamental questions, it would be, how are the students separated to ensure that these measures are implemented? Are they separated 6 feet? And what measures are in place to maintain that separation? Whether or not they're wearing the facial covering, if they can tolerate it or not, and the mask, and also to what degree are the staff and teachers are protected, because that's another aspect of the going back to school planning, is that our teachers who are at the front line, so to speak, must be protected as well.
Greg Akers, Memphis Business Journal.
Hi, my first question is for Dr. Randolph. What exactly is the holdup with the tripwire plan?
Well, I think that one of the things is we don't want to create a document that is, should I say, black and white. It needs to be fluid because the data changes. So we don't want to say if the positivity rate is a certain percentage, things will shut down. If the number of cases are, a certain number, we're still looking over that and deciding how fluid can this document be based on the data and being able to respond to the data. Our goal is to maintain as much progress as we can and not regress, but still reemphasize the importance of the safety measures that we've instituted, because that's all we have. The face covering, wearing a mask, the separation, the avoidance of crowding, washing of hands. There's no getting around that. And that's what we have to do in order to remain as open as we are.
Greg, do you have a follow-up?
Yes. This one's for Dr. Rudd. What is the turnaround time on tests that you're seeing right now that had caused some concern for you as you made your decision to go virtual to begin the semester?
Yeah, this last week we were having a test turnaround delay between 7 and 11 days, which was problematic for us. Delays over a week render results of limited value for us.
Dominique Dillon, Fox 13.
Hello, can you hear me?
Yes.
Well, one, can we get an update on the testing backlog? Is it getting any better?
The report that was given this morning is that the reporting has gotten better. The backlog is improved. Labs have increased their capability. And so now the average length of time that was reported this morning to the Joint Task Force was 3 days. And so if that holds and continue, then that would be a tremendous improvement and help. As Dr. Rudd just mentioned, 7 days delay really limits us in our ability to contact, trace, and to identify cases and place them in isolation.
And one more question. When may asymptomatic people begin getting tested again?
Currently, of course, you know that we're sort of prioritizing people with symptoms, people who've been exposed. So an asymptomatic person with the history of exposure can be tested now. I will assume that the question is more so, when can an asymptomatic person who has no history of exposure be tested? That will come as we further improve our testing capabilities in terms of turnaround time for the test results. What we don't want is for the labs to get overwhelmed again with results that causes the delay even in those who are at higher risk because they're having symptoms or have been exposed.
Katie Reardon, WKNO. Katie Reardon, WKNO. Okay, we will go back to Kendall Downing, WMC.
Hey there. My question is for Dr. Rudd. I was wondering if you could speak to, and I know we did a story on Channel 5 a couple weeks ago with Christian Brothers, and they really, President Shannon over there talked about you and some of the other universities and the challenges with some of the students and a percentage of the students that you serve with not having in-person learning and how that can negatively affect some students that may be from a disadvantaged background. I was wondering if you could briefly talk about that. Thank you.
Yes, I think for both of us, we've got a percentage of students, and as part of the unique role that we serve in the broader Memphis community, we have a percentage of students that have limited access to core infrastructure that's required, and what we're really referencing there is adequate Wi-Fi coverage, computer access, and software access as a part of it, and for some of our students, access to reliable food resources in terms of dining options and availability. And I think for both Christian Brothers and us, that's part of the motivation and rationale for making our housing available to those students in the coming months. And as I referenced for you, we've done that throughout the course of the past 6 months. And we've done that effectively. So we do have a significant percentage of students that's a challenge, and we're meeting that challenge. And I would tell you the data for us is that we're meeting that successfully. The other point I would make in our relationship with Christian Brothers is we have 2 facilities that we are using as quarantine facilities. And that's a part of how we've been able to manage effectively over the course of the last 6 months is rapid response and then quarantine as a part of the effort. We've made some of those quarantine facility rooms available to Christian Brothers and reached an agreement with them, given the fact that they did not have a facility like that available. And so we think that's not just effective for us and for them, but effective for Memphis more broadly.
We'll go back to Alex Coleman with WREG.
Yes, this question is for Dr. Rudd. Can you hear me?
Yes.
Yes, my question, Dr. Rudd, when it comes to the University of Memphis Tiger football team and athletics, where do we stand there for the season, as well as making sure players and the rest of the staff are safe?
All right, well, we have implemented, I think our athletic director gave an update a couple of weeks ago when we implemented some steps in terms of individual workouts, voluntary workouts for our football team. We brought the football team, our student athletes in, along with basketball student athletes. They've reported on that, I believe, on a regular basis. We've done that effectively. The athletic directors recently met. I will tell you that the American Athletic Conference presidents are meeting tomorrow to discuss and making decisions about a football schedule for the coming year. So hopefully you will hear an announcement about football scheduling in the next several days as we reach a decision on how best to handle that in light of the data that we currently have available from student athletes returning to campuses specifically within our conference.
We are out of time. Are there any closing messages from either of the panelists?
I would just like to reiterate the importance of remembering what has been required for us to get to this point. Wearing the face covering and the mask, the 6 feet separation. Citizens, there's no getting around for that. The virus is here. We got to figure out how we're going to live, how we're going to still enjoy life to the degree that possible within the parameters that's set, which are wearing the face covering, maintaining the 6 feet separation, avoiding of the crowds and gathering, washing of the hands.
Thanks, everyone.